Hello, everyone. It's DJ. I don't know. I just look to the right. It's interesting. But I have a class today on getting your COVID vaccination. So I'll let you know a little bit about my experience, but I'll also let you know about other people's experience as well. So the COVID vaccine, it didn't take too long a time. I had to drive to Walnut Creek, and that's where they had the test available. And I have to go back it was last Thursday, but I have to go back in a couple of weeks. And they give you the shot in the arm. It's a lot like a flu shot. You have to make an appointment, and the thing is, I think now there is a time that you can all go get vaccinated if you choose to do. I think you need to call your care provider. All I can know or tell you about what I know is kind of the information that Kaiser has given me, and I wanted this documented through them, um, because this way there's a record of everything that I've done. Like every nose swab and things like that. I want to have that documented in one place to look at it all instead of several different places possibly. So, like I said, I went in. Well, and I got my shot, but I went in. I got the shot. I will send you a picture of me there. I wore a sleeveless shirt, just my coat over it. But that way, it was a lot easier for them to just give me the shot in the arm. I could tell that a lot of people came in with full on clothes, like which is good in most public situations. But this was good for a sleeveless occasion. Um, went in, everybody was really nice, and they kind of directed me. And then what happened is that after I got my shot, they ask you to go to a station and sit for 15 minutes just to make sure that you're okay. And if you're having any symptoms directly after the shot. So you sit for 15 minutes. They put a little timer right on the table that you're at, and they say, all right, just wait those 15 minutes. And then, if you're having any problems at that point, they don't want you driving anywhere, I'm sure. But, they're like, if you have any problems, let us know, and we will, facilitate. And it was nice. I would definitely bring a book or something like that. Because I was told it could be like 30 to 45 minutes, and so 15 minutes was actually nice. But it was still nice. I had my phone so I could read some things, news on the jazz. Once I found out it was only 15 minutes, but I also had a book because I was expecting it to be a bit longer. And then they sent me home, and that's an excellent thing. They're like, you feel okay? Here's your next appointment. I've got my appointment card here. I would show you, but it's got some personal information on there, so I can't really show you. But then they sent me an email after. Thus, our class for today. Things to expect. And, and again, this is a personal choice. I'm not asking anybody else to get a vaccine because I got a vaccine. All I know is that I haven't gotten the coronavirus, and having been vaccinated, it's kind of nice to know that certain family members that I know as well are getting vaccinated, and I can go see them. I still need a mask covering. That is going to happen for a while, but I get to go see people, and they can come see me as long as they're vaccinated, and I know that they're vaccinated. So it's a good thing. But, this is kind of what to look out for when it comes to the vaccine. And I did have a headache for days. I still kind of have a headache. My jaw really got sore, and I noticed that the next day that my jaw was really sore, and my arm definitely hurt. But like a flu shot, it hurt. But the weirdness was the jaw, and then it was like, the headache is something that's not fun. But, you know, your body's trying to figure out, well, what did you just put into your body, and it's swimming through your system. So those are the things that happen for me. I also spoke to a woman right after I got home, and she said her entire arm turned purple, and she wasn't very confident in the shot. And there are two. There's the Pfizer and the Moderna, and both of them, people have reported different side effects. So, again, this is the class for today, but that's kind of my background and also other people's background. Some people have not had anything, and I've talked to them and they're fine. They're like, nah, yeah, it's like another day. My arm was a little sore. That's it. No headaches, no anything like that. But I would be prepared. You might have a not so fun day the next day as possible. But what does Kaiser say about it? So the first part of this is basically them telling me that this is your next appointment, and you need a second one, and it does say that vaccine supply remains limited, and to ensure vaccines are available to those with appointments, we are not able to vaccinate anyone without an appointment. So please make an appointment. It's not one of those things where you can just walk in and say, hey, like the flu shots used to be. It's not that way. And they have vaccine information. If you're a Kaiser member, please go to your Kaiser website, check in, and all the information is right there. And if you feel ill, have a cough, fever, or cold symptoms in the last 14 days, reschedule your appointment 14 days after your illness. So for me, it's more, I don't have an illness, I don't have a fever or anything like that, but I did have a headache and things like that. But that's also expected by having a vaccination. And also, if you've been exposed to someone with COVID-19 in the last 14 days, reschedule your appointment in 2 weeks. The COVID-19 vaccination shouldn't be given within 14 days of receiving another type of vaccine. So, if you're getting like an MMR shot, measles, mumps, rubella, then it's best to wait. You don't want those two things kind of fighting themselves off. Or within 90 days of receiving monoclonal antibody or convalescent plasma treatments, please reschedule your appointment if either of these applies to you. Now, the treatments they're talking about there, they have a lot more to do with people that are sick. Well, not sick, but they have like cancer patients and things like that need more help and need transplants and things like that. If you're not in that situation, don't worry about it. If you're healthy, then go ahead and, if you choose, make the appointment. If you had a severe allergic reaction within 4 hours of getting the first dose of the COVID vaccination, you should not get the second dose. I didn't have a severe allergic reaction. I think it was very minor. I feel fine. And you can cancel your appointment if for some reason the vaccination really did, you know, affect your system, the first one, then, you can call and cancel the next one. And it says, COVID 19 vaccinations or vaccines are safe and effective and have been vigorously evaluated. And that's due to, the science behind it, in that they have to make sure that this is safe for the public before they bring it out into the public. Again, with the MMR, measles, mumps, rubella, it's something that people they really have to monitor closely. And it says both Pfizer and Moderna vaccines meet FDA standards, which is the Food and Drug Administration, for quality, safety, and effectiveness. Both vaccines require 2 doses and are not interchangeable. So I got Pfizer, so when I go back the next time, I'll be getting another Pfizer shot. The first shot primes the immune system, and it helps it recognize the virus. And the second shot strengthens the immune process. The immune response to the COVID virus. And you cannot get COVID-19 from the vaccine. So right now, my body is trying to understand what's been, put into it. And it's kind of fighting off, anything that could, and it will recognize it. And the second shot is just kind of a pump up shot where it's like, all right, well, we did the first one. Let's get the second one and make sure that your system is strong enough to push through everything. And COVID-19 vaccine should be offered to women who are pregnant and or breastfeeding. So, if you're a pregnant woman, it's good information. Or if you know someone who's a pregnant woman, it's good information to let them know. You will need to wear a mask at your scheduled vaccination appointment and continue to wear a mask. Follow physical distance guidelines and wash your hands often after you have been vaccinated. And also, they have, at least at Kaiser, each table after you wait, they had plenty of hand sanitizer. And they had hand sanitizer as you went in so that you could, make sure that your hands were clean. And, it was a good thing. It was a good process. Allergic reactions. So it's possible that you could have an allergic reaction. So I'm not really allergic to many things, but pecans. But if you do have allergies, it's definitely something that your doctor should know. And this is again why it's best to go to, like an actual hospital. In my view. But COVID-19 vaccines are safe for most people with allergies. People who are allergic to most types of allergens, like animals, food, pollen, latex, or most medicines, are not likely to have an allergic reaction to the COVID-19 vaccine. You should not be vaccinated and cancel your appointment if you have an allergic reaction to polyethylene glycol or PEG, polysorbate, or any of the ingredients in the currently approved COVID-19 vaccines. And there are, again, if you're a Kaiser member, please read up on, I'm giving you the basics, but please read up on, if you have any allergies, if this will affect you, because I want to make sure everybody is safe. If you've had hot swelling, hives, trouble breathing, or anaphylaxis, yeah, that's serious. Within 4 hours of receiving any previous vaccine or injectable medication, the risk of developing another severe allergic reaction to the COVID-19 vaccines is not fully known. Again, it reacts different with everyone. You can still receive the COVID-19 vaccination per Center for Disease Control or the CDC guidance. You'll be observed for 30 minutes afterward as a safeguard. Like I said, it was only 15 minutes. But by the time you get to your car and you haven't fallen on the ground, it's probably about 30 minutes. Sorry, I shouldn't be. All vaccination sites have the appropriate medications and equipment to treat allergic reactions. So I'm sure they have EpiPens, things like that. So if you did have an allergic reaction, somebody would do the jab in the leg. But again, know your own medical history. If your medical history and you have a history of something, that's why it's best to go to a place that you trust. Because then they'll know exactly what they should watch out for. If you're concerned about a severe allergic reaction, you may consider waiting to get the vaccine until more information is available. If you'd like to discuss the risks and benefits of vaccination, contact your doctor. Again, I am not a medical professional. This information I'm telling you about because I've had mine, and I know people that have had theirs. And I want to make sure that you're as comfortable as possible when you do actually get it. And okay, so the last part is common side effects. The side effects reported are generally mild to moderate. They can last a day or two and are a sign that the body's immune response is working. Local side effects may include mild pain, redness, and swelling at the injection site. I didn't have anything major in my arm where they put it in, except for it just, it was sore. But they put a needle into you and then squeeze something in, and so, it's going to hurt no matter what. Well, it's going to, mildly. You may apply cool, moist washcloth to to the injection area. Using or exercising the arm may also be helpful. So just because it hurts, I guess what they're saying is don't just leave it alone. But, make sure other people know not to smack you there possibly. You may feel unwell, tired, or have headache, muscle pain, joint pain, chills, fever, nausea, and swollen lymph nodes. And lymph nodes are here. So you might feel that. And that might be kind of partially why my jaw hurts. And you can try, to take care of the pain. Over-the-counter acetaminophen, Tylenol or ibuprofen, Advil, Motrin, and always follow, the instructions on the package. Don't take too many. Take plenty of fluids. If these symptoms also do not improve within 2 days, you're supposed to call a certain place. And yeah, that's pretty much it. So, like I said, I suggest you do it. I will send you a picture, and we'll have a little bit of a quiz on just getting the vaccination itself. Again, I want to make sure that everybody's safe and feels safe about doing this, because it'll get us back to program a lot faster. But again, it is a very personal choice whether you want to do this or not. That's completely up to you. But I respect your choice. If you have any other questions or anything like that, feel free to call me or text me or whatever is most comfortable for you. But anyway, go Jazz, and I miss y'all, and I hope to see you soon, especially now that I've got my first one, and I'll get my second soon. Alright, bye.